Hi there, doctors. It's Bill here again, and it's been a while since I published any video on my YouTube channel, and that's for obvious reasons. I started my internship in a hospital, and that's been taking a lot of my time. So if you're here on my channel, you're probably here because you are probably a foreign medical graduate living in Poland or even outside Poland, thinking of getting back to clinical medicine. So the idea of this channel is to guide you through the process because it's just very easy to gather any information in English language. Most of the information out there for foreign medical doctors are going to be in Ukrainian language or Russian language. And I think I explained that in one of my early videos. So, yeah, today's video is just a quick update about how life feels like as an intern in a Polish hospital. Yeah, so I'm 6 weeks into my internship. Most of my time has been in internal medicine. So once you start your internship, you're going to have something called harmonogram, and that is basically a list of departments that you have to visit, things that you have to learn how to do whilst you're in this department. And this list is actually created by the Ministry of Health, and then it's passed to you by the local medical chamber, which is Izba Lekarski Okręgowy, which translates as the local medical chamber. So what you have to do is that you have to sort of follow it. And I think it's a good idea to strictly go by this harmonogram because I don't know, it's well planned. And I think starting off with internal medicine, it's a good idea because internal medicine is basically the fundamentals of medicine. And there are also procedures that you need to learn how to do during that 10 weeks of internal medicine. You need to learn how to do like paracentesis, pleural synthesis, and you need to be able to use a defibrillator and cardioversion. You need to be able to perform all these things, but it also boils down to where you are doing your internship. So if you're doing your internship in a small city like I'm doing, these procedures that I mentioned are done in the surgery department. But if you're probably working in a big hospital like in Warsaw, Gdańsk, Poznan, like any other big city in Poland, you would probably be able to perform these procedures right in the internal medicine department. So in my city, most of the things has to do with um, basically treating patients, pharmacological treatment of different diseases in internal medicine. And truly, I've been exposed to a lot of diseases. Even my first week, right, I had to deal with patients with cirrhosis. You have patient with chronic kidney disease. You have patient with heart failure, sepsis. So there's a lot of things to learn in internal medicine. I still haven't made that solid decision as to what specialty I would like to pursue for the long term. But definitely, I'm crossing internal medicine out because one thing that I do not like about this specialty is that I feel like there is a lot of documentation. So if you're somebody who do not like writing a lot, sitting down to write a lot, I would not encourage you to go into internal medicine. So what I'm trying to do now at this point is to find a balance between doing things with my hands and also basically thinking, right, playing that detective just like internal medicine specialists do. So I don't want to be a full surgeon because it's too much. I don't want to fully do everything with my hands. So that balance. And so far I've been getting a lot of recommendation about trying emergency medicine or perhaps anesthesiology. I still haven't had my rotation in anesthesiology and emergency medicine yet, but I'm looking forward to it. And I'd like to quickly take this opportunity to answer one of the questions, comments that was posted in one of my videos. Are you going to be paid for your internship? Of course, you're going to be paid for your internship. And actually, doing your internship, you're still a full doctor, right? You will get your medical license, which is going to be valid for 5 years. And within that 5 years, you need to pass your LEC exam, which is the final exam to convert it to sort of like a full license. So in the UK, it's more like you have your provisional license, but I know in the UK, you have your provisional license for 2 years. You need to finish your FY1 and FY2 to get a full GMC registration. So it's pretty much the same here in Poland, but the advantage is that here you have 13 months after you receive that provisional license, which is valid for 5 years to convert to a full medical license. And you are going to get your full medical license after you finish your 13 months of internship, which is paid. You can do extra hours. It's called the jour to earn extra money. So yes, you do have the opportunity to actually work, earn extra money outside the sort of the base salary that you are going to earn as an intern doctor. And after the 13 months, and then you have your leg exam pass, which is not a very difficult exam in comparison to the notification exam. The good thing about the leg exam is that 70% of the questions are going to come from the question bank. And the question bank, I think it has about 3,000 questions. So 70% are surely going to come from that. So it's quite easy in comparison to notification. So if you've made it this far, you've passed your nail exam, you've passed your notification exam, leg is not an exam to worry about. So once you have your leg, you have your 13 months of internship, which actually you have a 1 month of holiday in. So technically it's 12 months of internship. You will get your license to become a full doctor, right? And you could also do your specialization if you want, or you can be a lekarz bez specjalizacji, which translates as a doctor without a specialization. So that's it. If you have any questions regarding how to become a doctor in Poland, if you're a foreign trained medical doctor, please write your comment and I will be very happy to make a video to address your questions. Bye for now.